Hey guys, my name is Arathoria, currently a second year MBBS student at NHL MMC Medical College, Ahmedabad. So today's topic of discussion is that how to speak for the Viva as a first year MBBS student. Most first year MBBS student problem is that they know the answers but still get stuck in Viva, or sometimes it's that they feel intimidated by the teacher. So today you will learn that how you could speak or start the answer and feel confident about all the three subjects. The general info for all the three subjects is that start your answer as a define or in one sentence. If any teacher interrupt you while you are speaking, please stop immediately. Then be confident while speaking your answer. Take 1 minute to make a sentence, then speak in one flow without any interruption, as it will make a better impression on the teacher. Speak main words or points first. Not use any irrelevant or different word, as it can make the viva go off topic, and uh, it will be make much harder for you, as the teacher could ask different questions from that. So in anatomy, if I give you an example that how questions could be formed are in bone viva, hard part we can say, explain all the bony parts of the humerus. So as we know that in humerus, proximal end is there, which include head, anatomical head, greater tubercle, lesser tubercle, and etc. Then you have to speak shaft, body, borders, anterior, superior, anterior, lateral, medial, then surfaces, then delta tuberosity, radial groove, spiral groove, etc. Distal end where medial epicondyle, capitulum, trochlea, lateral epicondyle, medial supracondylar ridge, etc. Radial fossa, etc. are present. Then in second questions, it could be formed as explain anterior surface of the femur. So the anterior surface is vastus intermedius muscle origin, articularis chanus muscle, etc. are there. Then it could be a question as in hidden neck part or in brain neuroanat, such as explain all the foramen and the content of it, or explain any foramen such as foramen magnum, what are the contents of it, foramen spinosum, rotundum, etc. Explain all the muscle attachment at iliac crest. So you have to explain all the muscle origin, insertion on that iliac crest part. In soft part, explain ligaments of the liver. Then you have to tell all the three ligaments to and from where it is attached and where it attaches to other part. Then bare area of the liver. You have to explain all the five bare areas of the liver, such as porta, hepatis, IVC, uh, then triangular area, etc. Also, please remember the anatomical position of different organ, as if this is the wrong, then your whole marks will be deducted, as the examiner will know that you don't know even a basic stuff. Then remember heart, as it is very much asked. I have faced the great problems in that. In history, remember all the slide and identify, then answer 3 to 4 questions that they ask. In embryo, the questions can be formed as some of the are given. Explain derivatives of the ectoderm, endoderm, mesoderm. How kidney is formed? What are the possible abnormalities in kidney? What is horseshoe-shaped kidney? What happen if there is only one kidney development? Explain placenta formation. What abnormalities are there? What happen if placenta is not attached properly to the fetus, etc. In X-ray and surface fluid from your textbook or from the X-rays in your college. In physiology, there could be a hemat viva, then experimental viva and theory viva. In hemat viva, read your generals plus theory and then remember questions from it. So, for the example, I say in a practical of bleeding time and clotting time, name the method used. How much is the normal usual time? What are the conditions in which there is increase or decrease? In RBC count, For example, other practical in RBC count, how we can make that, what are the steps, what is the medium and the fluid used, in what condition it is increase or decrease. And if RBC is asked, it is but obvious that anemia could be asked, so you have to remember anemia, what is iron deficiency, what is folic acid based anemia, megaloblastic anemia, what are its morphology, what are the characteristics of it, etc. In experimental, read journals plus moments plus nerve supply. Also remember motor and sensory examination. Remember nerve actions of all the 12 nerve, cranial nerves. Then remember examination, general examination. Then remember how to palpate, percuss, inspect, and auscultate different parts such as in circulatory system heart could be asked that percus heart, what is apex beat. In abdomen it could be asked, can spleen be palpatable in normal condition. So exam answer would be no, that it couldn't be. So you have to remember all nine quadrants where organs are present, etc. In theory viva, like for example, if cardiac cycle is asked, you have to define that. So I have written here that it is a sequence of the events in one heartbeat, systole and diastole. Then main phases you have to say that isovolumetric contraction, ejection, isovolumetric relaxation, and healing. Then action potential could be asked that it is a rapid change in membrane potential involving depolarization and repolarization. Then you have to explain graph. Then what are the ionic changes that takes place during this action potential in blood grouping? O, A, B, AB blood group could be asked. Bombay blood grouping could be asked. What are the complications could be asked? In which condition blood is not, we can say blood is not donated. In what are the conditions could be if blood is perfused into the donor very quickly, etc. could be asked. In biochemistry, the main questions can be from any part, such as, for example, I have taken the two questions from the enzyme. What is Km? So we have to define that. Then what is competitive inhibitor? What is uh, other types of inhibitors are there? Then what is in competitive inhibitor? Inhibitor competes with substance. Vmax stays same and Km increases. Then vitamins are mostly always asked in any biochemistry part. So you have to remember them very thoroughly. Why is vitamin B12 very important? Need for DNA synthesis, deficiency, on megaloblastic and neuropathy, vitamin B12 deficiency could be possible. What are the functions of vitamin A? Help in vision and epithelial integrity. Deficiency can be night blindness. In night blindness, deficiency of vitamin A is seen. In clinical cases, could be asked such as in what jaundice does, how it is, explain all the three jaundice. Then why does the ketone body formation increases in diabetes? So answer could be because lack of insulin increases the fat breakdown and acetyl-CoA ketone. Then acid-base viva are also very common. Miscellaneous viva stuffs are common. What are protein folding disorders? What are the chaperones? What in metabolic acidosis, and what are the common signs? In metabolic alkalosis, what are its common signs? Then if in metabolic alkalosis is asked, what are the top topics you could say, that is pH is high, HCO3 is high, what it can be caused due to vomiting and antacid. So any other function test could be asked, such as liver function test, renal function test, thyroid function test. In liver function test, which enzyme is increased in hepatitis? What are the increase in obstructive jaundice enzyme? In heart, what are the enzyme markers that could be detected in myocardial infarction, etc. These are the just above are the few examples that help you to understand that how questions could be formed in the Viva. So you have to read each and every topics very thoroughly so you could answer them properly. So if this video have helped you and you have been benefited by this video, please share it to your other friends. And if you like this video, please subscribe it.